about funding for these kinds of initiatives, having support from CIHR, because CIHR has recently been thinking about funding projects that look at the translational research, the clinical research, those kinds of things. And I'm just wondering, from the CIHR perspective, has there been any discussion about any support for e-health-related research services and those kinds of things?
Well, as you know, Lakshmi, CIHR has embarked on funding of a series of networks in health research. And what has just been decided is that they're going to, in choosing the next candidates, look forward to receiving suggestions from the community. So I would think that this would be a topic that would be ripe for such a proposal. So the opportunity is there. You know, if there's enough interest and there's enough expertise, and especially if the provinces buy in, because that's the key. In Canada, as Jeff said, the provinces quite properly hold the access to care. And so they have to be part of this conversation or it won't go anywhere. So there's a role for the national government, and we would probably be quite open to supporting the proposals for the research component. But the knowing that you actually have a chance of translating that because you have as your partner an end user, that will be a winning combination.
Thank you. Kendall, I think you had your hand up.
Yep, I just want to support the importance to capture the evidence to inform where we want to go today, but also the potential, the continuing capturing of the evidence as we move forward. Because it would be a waste, a little bit of a waste, if we just do, but in 3 years' time sit here with the same amount of evidence without building on that evidence, not only on an international front, but also in the provincial and community context. I think it's just fantastic if we can set up that evaluation framework, not only to continue to add to the evidence, because technology will change, but to leverage that evidence to say in 3 years, we have actually more information about that. But also not only on the evidence of the intervention itself, but evidence of change. Evidence that this knowledge translation has succeeded. We've penetrated on the policy-making front, the consumer engagement front, the patient front, health professional participation front. I think it's really exciting.
Yeah. Could I just add to that? One of the powerful aspects of online stuff is that you can have records, keeping records as people are using that system. So, for example, with Moodgym, we keep records as people go through of how their mood is changing. And we report that back at a 3-monthly interval, obviously not at an individual level, but at an overall level, and we have information about the demographics and so on. So you can actually, it's perfect for monitoring what is actually happening in terms of outcomes at an effectiveness at a real live level. And that's a real power, I think, of e-mental health that you don't get with other systems.
Somebody had, yeah, go ahead.
Summarizing what I've learned here today, because there's a lot. I see that we've talked about citizen democratization of health, where we've talked about self-learning, we've talked about finding information and sharing information. We've also talked about citizen services, which to me is the other side, which is the conversation now about what do we provide, face-to-face services, online services, backup services. What happens when I find some information online that makes me nervous and I need somebody to call? And then somewhere in between there's this business about the internet and the stuff that's already out there. And then there's my health record and information that I want to have access to, and then in place that I want to put my information so that I can look at it and manage it. And maybe I don't want to put all of it there. I just want to put the stuff that I think is relevant. And then having somebody else also have access to it and being compelled, that care provider, to look at it in, as well as the other information that we're capturing through our other services, labs, pharmacy, whatever. So I guess my question is it's a very big picture. And then we talked about evaluation, and we talked about endorsement. So I guess the question I have is, we look at the different levels of governance here, and I have to think of the citizen as a level of governance themselves, because if they don't like what you're doing, they're going to stamp you out on Facebook. So, so we've got the health authorities, we've got the government, we've got primary care, we've got citizens. What are the roles of these 4 levels? That's my
Probably will take about a year for us to figure that out.
Listening to you
Quick response,
summarize
and
all where we've gone with the conversation this morning, it is sound like, my God, it's a huge complex piece. And yet, we want to get on with it. We want this stuff because we're so woefully deficient in services for people with anxiety disorders and depression and so on, and we know that. It does take, you have to start somewhere. And fortunately, we're not starting at zero. We're starting at a fairly high level because of other countries that have led this. And we have some experience in terms of what gets done at a national level, what gets done at a provincial level, what gets done at a regional level, and what gets done at a local level. So if we kind of take a PDSA approach to this, Plan, Do, Study, Act, and then recycle it, and make sure that we get it fitting in properly in the first place, it may be focused on, from my perspective in Vancouver Coastal, within the rubric of our mental health and addictions program. Okay, which then brings in the 4 major areas of one region. And whether we call it a pilot or a phase 1 or whatever it is, we would do that with complete knowledge and support from all the other key stakeholders. So research institutes, the universities, the colleges, the Ministry of Health, the Mental Health Commission of Canada, et cetera, and say, we're moving on this. We've got enough information. Are you going to slap us down or get the go-ahead? And I personally think if we try and build it as a whole provincial thing even, first out, we'll struggle. It'll take us 3 times as long. So I'm really keen on getting in and getting going and demonstrating that this can be done within the context of a system, a regional system. We know all the players and making sure that we are totally tight with all those stakeholders, but not asking them right on the way up to the national level to approve, sanction, whatever. That would be my approach.